Acne. When you develop acne, you develop a lot of redness. You develop a lot of inflammation. This redness and inflammation in the process of healing will get in a lot of melanocytes. That will again cause a dark spots. So when you're developing acne, make sure you use sunscreen so that the intensity and the severity of pigmentation can be reduced. Hello everyone, I'm Dr. Keerthana Kalva. I'm a Chief Aesthetic Dermatologist at Inform Clinic. Today I'm going to tell you about how to do your lifestyle changes and few modifications to prevent pigmentation or dark spots on your face. So first and foremost, I'm going to divide it into two types. One would be your health related lifestyle changes, and then other would be your protection related lifestyle changes. So first, coming to health, exercising is compulsory to prevent or to reduce your dark spots. So your diet also plays a very essential role to prevent pigmentation and also to decrease your dark spots. Now coming to the physical lifestyle changes, one would be using a sunscreen regularly whenever you're stepping out, and second one would be making sure you use a physical protection as well, like wearing a scarf or using an umbrella when you're going out actively in sunlight. And third most is make sure your skin is hydrated. Drink plenty of water, minimum 2 to 3 liters. So first, exercise. How exercise helps in preventing the pigmentation? When you exercise in general, you increase the blood circulation to your skin. Because of this increased blood circulation, there will be improvement in the oxygenation, which will help in the cell turnover. So cell turnover is nothing but it is a cell to cell association, and the time where when the cell gets old, it needs to be peeled off and the new cell needs to be formed. So when there is a good cell to cell addition and there is a very good cell to cell turnover, that is when your skin behaves well, and that is when there is an association between a keratinocyte and a melanocyte. Now keratinocyte is a cell that stays in your skin, like in the epidermis of your skin, and melanocyte is a cell that is responsible in giving a color. Now when this keratinocyte and melanocyte have good association, like they are supposed to have, that is when you don't develop pigmentation. When there is excess melanocytes attached to a keratinocyte, that is when you develop hyperpigmentation or dark spots. So to avoid that, your exercise is going to help in this process because it helps in improving your cell turnover. And exercise also helps in decreasing your insulin insensitivity. When you have lot of insulin insensitivity, there will be decrease in the cortisol production, which is very essential for our body. Every day morning, a small dose of cortisol is produced, and that helps in our well-being, that helps in our body functioning well, that also helps a lot in our organs functioning very well. So when there is an insulin insensitivity, your cortisol decreases. When your cortisol decreases, your melanocyte stimulating hormone increases. So that means you are excessively producing lot of melanocytes. Thereby again, it will end up with a hyperpigmentation or dark spots. So that's how exercising is going to help when you have a hormonal imbalance. Majority of the people who have hormonal imbalance also have problem with the decreasing in the cortisol level, and people who have hormonal imbalance also have insulin insensitivity. So exercise will help in maintaining your hormonal balance, and indirectly this hormonal balance is going to help with your pigmentation. The second most cause is your diet. So when you have a diet rich in calorie, that can be because you're consuming high loads of sugar content, or high loads of fat content, or high loads of processed carbohydrates. You get to see a lot of these processed carbohydrates in your white rice, in your maida based foods like samosa, puff, your pizza, your burger. So all these are essentially made up of maida. So all these food items which I have mentioned, they're rich in calorie, less in nutrition. So when you have calorie rich diet, that also leads to developing insulin insensitivity. And once you develop insulin insensitivity, it causes stimulation of your melanocytes, and that increases your chances to develop hyperpigmentation. So when you are little on the heavier side, make sure you exercise and also follow a diet. So you can go with a diet. Make sure when you're when you want to diet, make sure you eat salads before each meals. Bring down your calorie food. Switch your white rice with brown rice. Eat good amount of your curry content rather than your rice, and along with that, make sure you eat fruits instead of eating or instead of drinking fruit juices. Fruits make a lot of difference. When you have a fruit directly, it is more rich in antioxidants and rich in nutrition rather than when you make it in the juice form and consume it. So these are your lifestyle modification when it comes to exercise and your diet. When it comes to a physical lifestyle modification like using a sunscreen, now, you might feel, why should I use sunscreen? I'm very young, I'm just 20, there is no chances for me to develop hyperpigmentation. But no, if you are on a healthier side, if you already see signs of hyperpigmentation like around your neck, on the sides of your cheek, around your chin area, that means yes, you need to protect your skin, you need to use sunblock whenever you're stepping outside. Along with sunscreen, also make sure you hydrate yourself properly. Drink 1 to 2 liters of water. And if you're going out actively in the sunlight, doing a lot of shopping, or you're on the beach place, make sure you use an umbrella or at least physically tie a mask that can prevent any further damage to your skin. It can also prevent dehydrating your skin. It will also protect your skin from pollution. So next thing is acne. When you develop acne, you develop a lot of redness. You develop a lot of inflammation. This redness and inflammation in the process of healing will get in a lot of melanocytes. That will again cause a dark spots. So when you're developing acne, make sure you use sunscreen so that the intensity and the severity of pigmentation can be reduced. Along with that, also make sure you hydrate your skin properly. You can hydrate your skin by using aloe vera, your home remedy, or your cucumber. Both of these are very good in hydrating your skin. Once your skin is very well hydrated, and if your skin needs to heal from severe damage, like if your skin has experienced any allergic reaction and it became red and you develop few water bubbles and then it is healing with a fine scab, or let's say your skin experienced some unfortunate event while taking steam, or there's a spill of oil, so that is when you notice your skin has become red, and then it will start to become, you develop a fine black scab. So when you develop that black scab, moisturizing your skin is very important. So hydration and moisturizing your skin makes a lot of difference, because both this help skin heal better. When your skin heals quicker, when your skin heals better, the chances of developing pigmentation is much, much less. And if in spite of all this, if none of this works, you always can go visit your dermatologist. Based on the kind of dark spots you have, based on the severity of pigmentation you have, they would be giving you the right kind of suggestions. If you still have any doubts, please leave it in the comment section, and please do subscribe to our channel to learn more newer things about the skin. Thank you.